So for structural, this meeting's being recorded. So structural determinants of health must be our focus. So we talk about social determinants of health where people live, work, play, pray. And I want to talk about structural determinants of health, right? So moving to governing processes, economic and social policies that affect pay, working conditions, health, education. And as we start to address structural determinants of health, we can start moving forward and ensuring that we have more connected communities. These structural determinants affect whether the resources necessary for health are distributed equally in society or whether they're unjustly distributed, as we have seen for decades, if they're distributed according to race, gender, social class, geography, even sexual identity, or other socially defined groups. Why do we need multi-sector collaboration? So building connected communities means we need to engage all players. I feel like the pandemic that we currently still live in has really highlighted the need to ensure that we kind of break out of these silos that we've worked in for so long. And when we talk about the maternal infant health crisis, our ability to address these issues means that we need to bring all players to the field. So we need to engage public health, community development, philanthropy, local government, community organizations, academic institutions, and so on. And when we start to bring in other sectors, we can also bring in dollars and we can bring in community members. So Eric, this paper written by Erickson et al. David Erickson currently works for the New York Fed. And he published his paper on building a successful multi-sector health partnerships. Often when I talk to organizations about building multi-sector partnerships, if it's either a community-led organization, if it's community development, public health, this idea of multi-sector partnerships doesn't seem to really resonate. People often ask, well, how does community development drive health? Or how does economic security drive health, right? People usually just assume, well, if we give people access to care, then we're going to have increased health outcomes. But we really need to ensure that we start tapping into these multi-sector partnerships. So there's multiple phases, and I believe our PowerPoints will be shared where if you want to dive further into this, you can, but there's these multiple phases. There's this early phase, middle phase, and late phase in order to start building these partnerships, bringing individuals or new stakeholders to the table, experimenting with how we can establish these multi-sector partnerships, all the way to kind of changing the core practices of organizations to ensure they better align with other organizations so they can continue to foster those multi-sector partnerships. Bringing other organizations in and fostering these multi-sector partnerships is often difficult. But being able to identify a common mission, a common vision, and finding those areas where you align really starts to foster that sense of community. So what are connected communities and why do they matter? So the Thriving Together, a springboard for equitable recovery and resilience in communities across America was published by the CDC Foundation Wellbeing Trust in 2020 and kind of set these vital conditions, right? And I really like this quote, our best hope, sorry, this is in my way. Our best hope for escaping the adversity spiral and changing course is to organize local and nationwide action around a single unifying and measurable expectation that all people and all places are thriving with no exception. From there, they defined the 7 vital conditions or the properties of places and institutions that everyone depends on to reach their full potential. So these 7 vital conditions, not ranked in any particular order, though through some of the work that we have done, we have noted that belonging and civic muscle tends to kind of sit more towards the top. But your belonging and civic muscle, thriving natural world, basic needs for health and safety, humane housing, meaningful work and wealth, lifelong learning, and reliable transportation. Addressing these vital conditions then allows people to really thrive in their environment. So why does social connectedness matter? Well, we know that connected communities are healthier communities. A place where everyone feels like they belong and their community reflects their own desires and ideals. And that's where belonging and civic muscle is often ranked as one of the most crucial vital conditions. You can't really have the other 6 vital conditions addressed if we don't put belonging and civic muscle first. Someone feels like they don't belong in their community or they don't have the opportunity to engage in either advocacy or make their opinions voiced, then the other vital conditions can't even be met. If our communities do not foster a sense of belonging, we cannot properly address health inequities. How does connectedness drive health? So the first thought that comes to mind when I think of connectedness and the work that we've done is really community development investments matter. Investing in community centers and libraries, healthcare clinics, childcare facilities, parks and sidewalks, all the way to healthy food outlets. If we aren't investing into our community, our green spaces, and our built environment, then we see the ramifications that it has, especially in our redline communities. As we pour money back into the communities, we see that, again, that sense of belonging rises and that we can have more positive health outcomes. Neighborhoods matter. We often think that genetic code is the main driver of our health outcomes. We know that that zip code now tends to be the main driver and determinant of someone's health outcomes, where they work, live, pray, and play, right? Those social determinants of health. Safe, affordable, and stable communities with good schools, fair paying jobs, and access to healthy foods and green spaces is truly foundational to well-being. Community development can help drive community connectedness through thoughtful partnerships and dollars. And, as I said, Bruce, that connected community is a healthier community, but how do we get there? And the title is Virtual Summit, right? Moving from data to action, and then got me thinking about policies moving forward. So where does policy plug in? So I'm part of an organization called Shift Health Accelerator, and we partnered with another national organization called Build Healthy Places Network. And we had this Healthy Neighborhood Investments, a policy scan and strategy map that was funded by the Blue Shield of California Foundation. And this tool, it's linked here under this scan. This tool identifies several policy actions for advancing health and racial equity through cross-sector investments. We tapped multiple community development community-based organizations. We listened to leaders in the field, and we convened panels on how to have healthier communities and how community development and the healthcare sector can partner to move forward. So this scan frames pathways and opportunities for community leaders to advocate for policy change by healthcare policymakers and community development. It identifies policy barriers and ways to overcome them for joint investments, specifically addressing the social determinants of health, right? And it identifies policies that create a more conducive environment for collaboration across sectors, right? So as I talked about earlier, those multi-sector collaborations in those different phases, and incentivizes healthcare to consider community development organizations as important partners in shaping policy and investments in social determinants of health. And from a local government standpoint, I'm a commissioner in the city of Redlands, which is located in Southern California. And this is where we start to think about, right, our structural determinants of health. So local government wields a lot of power, and government structure matters. For example, the way that our local government is set up, we have 5 elected city council members. And then from those city council members, we have our mayor that's picked, and our mayor then picks who our city manager is. And our mayor and city manager then decide our budget allocations. They decide kind of that strategic plan for our city. Unlike a lot of other cities, we don't have a rotating mayor. So though I may vote for one city council member that I feel like reflects my views and the needs of my small community, my council member may never sit on or sit as mayor for our city. And so that truly matters when the decision power ultimately comes down to the mayor as well as the city planner. And so we often ask people to ask about budget allocations, try to understand who is partnering with who, what meetings are open to the public and why. And if we want to drive connectedness, we must engage those who matter and those whose voices have often been stamped out. And that's where I often ask individuals to ensure that they're going and they're engaging in public comments. So from over the last year, the public comments that have been submitted and the discussions that have happened, we've been able to declare racism as a public health emergency, been able to provide utility bill assistance programs and ensure that money is being utilized in the correct manner for our ADA accessible areas. So listening to the most vulnerable often allows us to start addressing some of those underlying issues. So some closing thoughts. So think about our communities and the role they play in health outcomes. Social and community connectedness is as important as ever. Connected communities need more stakeholders at the table, and we need to ensure that we try to foster those multi-sector partnerships in order to help shape healthier communities. And local government matters. Advocating from that community level and allowing members to make those decisions will truly can start to move that needle forward. And advancing health outcomes and addressing the maternal infant health crisis will not be accomplished if we mince words. Racism and racist policies must be addressed, and we must think of innovative ways to address these inequities. I'd like to just thank my partners at the City of Redlands, Build Healthy Places Network, Shift Health Accelerator, and the Blue Shield California Foundation. Thank you all so much.
Thank you so much, Zachary, and thank you so much, Zaya, for those amazing presentations. So before we launch in the Q&A, I have a brief announcement, which is that we want every single person on this webinar to take action at our Action Center. You can use the QR code on the screen that you see right now. We are also putting it in the chat. And I'm going to pass it to Kristen to make a short announcement, and then I have questions for both of you.
Hi there. Thank you so much, Dr. Long, and to both of our presenters for your wonderful presentations today. I just wanted to take a moment to urge you all, as Dr. Long said, to take action by visiting our Action Center on the March of Dimes website. As you know, we need your help urgently to keep the Paid Family and Medical Leave Act in the Build Back Better Act. I'm sure you all know that the US is the only industrialized nation that does not offer working families paid time off to care for their new child. As a result, many families have to make serious financial sacrifices to have a baby. Establishing a national paid leave by passing the Build Back Better Act would provide this vital benefit to 77% of workers who don't have paid family leave. We need your help to make sure that this stays in the act, so please contact your lawmakers today by scanning the QR code or visiting the link that we put in the chat. Thank you guys so much.
Thank you for that announcement. And now, Dr. Malawa, my first question is for you. And, you know, we have time. This is a multi-part question. And so I am such a huge supporter, and I have so much respect for the A Billion Birth Project, and I love your communication style about respect and honoring. Can you talk about how did you begin ideating about the Abundant Birth Project? How did you start to think, even before you hired the moms to be and the eligibility criteria? Like, how did you start to formulate it in your head? Because it's such an amazing and necessary idea. And now, once you are launched, how are you thinking about sort of sustaining and scaling to other areas? Because we should be doing this across the country.
I totally agree. We should be doing it across the country. The way how Expecting Justice, which is the lead agency for the Abundant Birth Project, operates is that we have a collective steering committee that's made up of leaders from across San Francisco, but also centered around Black and Pacific Islander mamas. And so when we were first launched, we were basically given the charge to do something about birth disparities in the city. And so we went through a lot of I used a lot of design thinking strategies to kind of help us develop some ideas and come to consensus. But ultimately, the mamas on the steering committee let us know that people are broke and they can't afford the basic things that they need in order to have safe and healthy pregnancies. And right around the same time that we first started, coming to that recognition, a paper was published out of Manitoba, Canada, who's been doing a pregnancy income supplement for over 2 decades, but they hadn't really done much research on it. And they were able to reduce preterm birth rates by over 17% with just an $80 a month stipend. And so we felt like that is definitely a mandate to try something like that. I don't want to take full credit for it. One of the amazing things that we have on our steering committee is a member of the Federal Reserve Bank of San Francisco. She's part of the community development team. And so she was the one who was really excited in bringing the research to us. We shared it out, everybody felt enthusiastic. Now, when I think about the long-term sustainability, I used to have a lot more worry about it than I do now, because we started this process over 2.5 years ago when the idea of guaranteed income was not popular. And frankly, when we first approached a lot of funders, people were very anxious about giving unrestricted cash to Black people because of their own biases and racism. And so we've come so far in the meantime, and it's very painful that the things that have happened over 2020 have happened, but it's kind of helped people reach the understanding that we need to be addressing anti-Black racism specifically, and help people understand the power of cash, because there are so many guaranteed income pilots. And so, as I mentioned, in California, very, very soon, there was going to be $35 million available to try and expand these pregnancy income supplements. Our dream is to be able to expand the Abundant Birth Project throughout California, because right now 150 moms is not enough to generate statistically significant results. And so we are hoping to spread this out, get money and spread this out to 6,000 to 8,000 moms across California, so that we can start to create the evidence that I think we would need in order to, I don't know, like start to liberate McVie funding so that we could use it for home visiting and cash supplements, for instance. So that's what I hope will happen in the future. But that depends on the willingness of funders and the willingness of my team to keep on grinding.
Yeah, there's a comment from Isadora that says that would be amazing to have abundant birth across California. And we all agree. I'm going bigger than that. I'm saying across all of our states. And so just another follow-up question. What would success look like to you as a result of the pilot?
I think that there's a few things that we would like to achieve. I mean, definitely we would like to have an impact on preterm birth disparities, infant mortality disparities, maternal mortality disparities. I would love to see that we have created a significant enough impact that people feel like this is a viable solution. But I think also I really hope that we can kind of change the narrative around Black moms, frankly, because there are so many challenging narratives that kind of leverage really harmful stereotypes around Black moms that are completely untrue. We know that Black moms are the most likely to work while they're pregnant, while they are birthing, while they're parenting. We also know that Black moms are the least likely to get paid what they are worth. And we see the impact of that in our birth outcomes. And so in my dream, Black women and Black parents in particular would be seen with their full humanity and their full dignity, and that the entire country would therefore understand that when we have these persistent disparities, it's an urgent issue. So that's what I hope.
You're getting such great feedback in the chat. And Zachary, I will move to you, but this line of thinking, I'm wondering if you might be able to share with the folks on the webinar some of the data. Like, I'm thinking particularly about the data that came out that said that if a Black baby is cared for by a white doctor, right, there are worse outcomes for that baby than if they're cared for by a Black doctor. And if you could talk about what that data means to us as Black women and to our babies.
Yeah, so that was an incredible study done by Rachel Hardiman that showed that Black babies were more likely to survive if they were cared for by Black doctors. But I know that you and I understand how difficult it is to be able to have enough Black doctors to serve all of the Black birthing people, because we don't have systems in place to support Black people, whether they are parents or medical students. And so I think that honestly, it's such a painful manifestation of racism, right? Like, it's your baby, it's your mama, and it's their lives on the line. And so I just really genuinely hope that we in this country find the motivation to do whatever it takes, whether it is more scholarships for Black medical students or a cash supplement that rolls out nationally, but whatever it takes to create an environment in which Black birthing people and other birthing people experiencing marginalization can feel safe and protected while they go through this important life experience.
I couldn't agree with you more. If
Can
there
I
are
ask her
other
two
questions, everybody please put them in the chat. But Zachary, go ahead. You have a comment, please.
Yeah. So I'm just curious, yeah, amazing program, but how do you think we start to have those conversations and these types of programs in more rural areas and less progressive states? And then also the second, my second question is, do you think that the influx of internationally trained physicians here in the United States is either going to hurt or kind of help the inequities that we see in healthcare?
Ooh, okay, getting spicy. So I think as far as rural communities go, when we fantasize about rolling this out California-wide, we absolutely think it's important to pilot it in a variety of settings. So certainly urban settings like San Francisco, also suburban settings where more and more Black people are being pushed out to, and then rural settings because we have Black birthing people in those areas as well. I also think that I myself am not an expert with the Native American community, but I absolutely recognize that something needs to be done about adverse birthing outcomes in those communities as well. And many Indigenous people live in urban areas, but also in rural areas. And so I think that in the same way that we had to engage local Black and Pacific Islander women in order to make the program successful, if this were to roll out into rural areas, there would need to be some of that pre-work, that formative work with local folks to be able to understand how we need to change and nuance this program so that it works with that specific community. I think as far as trying to get things passed in, more conservative counties, on one hand, like this is the challenge that we have for all aspects of dismantling racism in conservative counties, right? Like if people don't actually value Black lives, then it's very difficult to have a conversation about why we should be doing things to prevent maternal death and infant death of Black people. But that being said, I will also point out that 1 in every 6 Americans lives in California, which is where we're piloting this. And so where California goes, a lot of times other people go. And so I'm hoping that we can create enough pressure at the national level that this could potentially roll out without necessarily having buy-in from very conservative and racist politicians. I don't have a whole lot of thoughts around international doctors, but I can say that, one of the things that has been hard to watch, at least locally, is that medical schools in the Bay Area have been advertising some of their most diverse incoming classes that they've ever seen in their history of accepting new students. But when you look a little bit more closely, especially in terms of who is being accepted that is Black, a lot of times it is not middle passage Black people who are getting accepted to medical school. It is a lot of African and Caribbean immigrants. And I think that everybody needs to be able to have providers that represent them. But I think that there is something that is potentially harmful if once again, middle passage Black people are being left out. And so I worry sometimes that, the categorization of race is not nuanced enough to make sure that we're really able to center on the margins, because I haven't seen a significant increase in middle passage Black people like myself getting into medical school. So again, I don't want to say this. Oh, go ahead, please.
Can you define that for the audience?
Sure. So when I say middle passage Black people, I'm describing African Americans who came to this country, whose ancestors came to this country through slavery. And I'm using that term to distinguish from Black people and potentially African American people whose family came after slavery, maybe as immigrants from West Africa or the Caribbean. And those people also experience racism and also very much deserve to have providers that represent them. But I just hope that we can continue to make space for African American folks that are of slave descent, just so that they don't get marginalized even further.
I'm just thinking to myself, hallelujah and amen and yes to all of that. Zachary, I'm wondering, I was struck by your presentation about, you were talking about flexing our civic muscle. And can you talk more about how do we as individual community members actually flex that muscle? What are ways that we can go about making that change? Because we talk about these structural determinants of health, and oftentimes people might not know. So how am I going to make more safe, stable, and secure neighborhoods possible?
Yeah, thank you for that question. It's something that I often think about, and that's where I was discussing just from community level and local government level, and the engagement of just local officials, and trying to understand where dollars are going and why they're being spent the way they're being spent. So my city sits in San Bernardino County, which is the largest geographic county in the United States and poorest county in the United States. There were some concerns about the way dollars were being spent, especially for our county commissioners, right? And some digging revealed that our county commissioners are making $250,000 a year, while the local median income is less than $40,000 a year. And so there was a measure that was put forward that wanted to knock down how much money these commissioners were being paid, when obviously we don't see any increase in health outcomes, economic security, housing, and saying, hey, we're going to pay you what the average person in this community is making, or family's making. And if you don't do a good job, then you're out after a year. That measure passed with overwhelming support, but the commissioners were able to also put in another measure that stated if any measure is passed in this county that the commission does not think is within their best interest, they can overturn it. So that was really disheartening, and it was upsetting to see that after community engagement, community voice was finally uplifted, and we were able to put a measure on the ballot that passed, and we had commissioners that were able to come in and knock that down. So we hope that come 2022, we can put that measure back on the ballot. And that's where, then circling back to City of Redlands, the public comments. The public comments have literally driven the conversation over the past 2 years around racism as a public health emergency, around economic insecurity, around the racist redlining policies that have allowed for there to be a segregating line. Drive down the freeway, and you can see on one side we have community that wasn't redlined, and the opposite side, the community that was redlined, and it's starkly different. And so these public comments and the willingness of our community members to be engaged has allowed for these different measures to be passed, and has allowed for programs like our utility assistant program to put $120 back into the hands of our community members. And that's big for some families. And so that civic muscle is often hard to flex, in a sense where from individual to individual, they often don't realize how much power they wield. And so I think if you foster that belonging, and if people have a better sense of community, and then they can engage and understand how important their civic engagement is, we can really start to see a transformation in our communities. And hopefully then that will drive newly elected officials to want to see healthier communities.
So one of the other topics that you discussed, and I know this is a doozy of a question, we have probably 2 or 3 minutes to answer it, is about the importance of social connection and cohesion. I often struggle with that concept because I think, well, how do you actually measure it? How do you know when it happens?
Yeah, I mean, it's difficult in a sense because I don't feel that social connection and cohesion can really be measured and witnessed until we address all of these other underlying issues. And so once we start to address inequities that exist in schooling and healthcare and the workforce, and after another generation, so in 20 years, I think that we'll be able to point back and say, well, look at the connectedness of this generation and this community compared to the connectedness of this generation, or this next generation. And maybe then we can point to, well, our ability to address all these underlying social determinants as well as structural determinants has had an impact on social connectedness and cohesion.
Yeah. Well, I want to thank both of you guys for all of your beautiful presentations and really helpful words. We have a treat in store for us next. We next have our keynote, and our keynote, you guys don't want to miss it, is Dr. Michael McPhee from Policy Link, and he is talking to us about harnessing your power for this moment. And so please stay with us. And then after the keynote, we're going to have strategy-focused roundtables where we can continue the conversation. If you'd like to find out more about the Mom and Baby Action Network and what we're doing, please go to the Igniting Impact Together website, get involved. The link is in the chat. Thank you all so much.